Hello, welcome to my student support system. In today's class, we will discuss about a childhood disorder that is Omphalocele. This lecture is in English, and if you want to study in Hindi, you can click on I button so that you can get link for Omphalocele topic in Hindi. You can also visit channel. Let us start. What is Omphalocele? Omphalocele, also known as exomphalus, it is a birth defect of abdominal wall. The infant's intestine, liver, or other abdominal organs herniate outside of the abdomen through umbilicus. The organs are covered in a thin, nearly transparent sac that hardly ever is open or broken. So this is sac, which is also known as exomphalus sac. Omphalocele forms when there is a failure of lateral infolding of embryo that happens in third to fourth week of gestation, resulting in an inadequate abdominal cavity with containment of abdominal organs only by a thin clear membrane called omphalocele sac. Smaller omphalocele, also known as hernia of the cord, form in later stage of infant fetal life, that is in 8th to 11th week of gestation, after normal infolding of the embryo, when the umbilical ring fails to close around the umbilical cord, resulting in a small defect that usually contains only a part of intestine, like this. Now we come to sign and symptoms of omphalocele. Omphalocele can be identified immediately just after birth by presence of exomphalus sac outside abdominal wall. This is the only sign, no other sign or symptom needed to diagnose it. Now we come to diagnostic investigation. What diagnostic investigation we do for confirmation of omphalocele? Just observation and physical examination just after delivery. The presence of exomphalus sac outside the abdominal wall is diagnostic feature. It can be diagnosed by ultrasound before birth, which is known as intrauterine diagnosis. After diagnosis, we start treatment. Surgical repair of omphalocele take place soon after birth. As soon as we diagnose, we are ready for surgery. The type of omphalocele treatment is determined by the overall health of the baby, especially his respiratory status, the size of omphalocele, and degree of liver involvement. Babies with small omphalocele are monitored closely until they are ready to undergo primary repair. This means the herniated organs are placed back into the abdominal cavity and the defect is completely closed in one operation or generally on the same day of the birth. For babies with giant omphalocele that contain the liver and other organs, a staged or phased manner repair, which involves several steps, are needed to gradually return the abdominal contents back. This gradual process provides time for the abdominal wall to stretch and to accommodate the viscera or organs and ensure that the lung can continue to grow and expand without immediate pressure of surgical closure. So what nursing management we need for these babies? We can divide the nursing management in two groups: the nursing care before surgery and nursing care after surgery. Pre-operatively, vital signs should be closely monitored and recorded. The exomphalus or omphalocele sac should be prevented from injury or infection. Nasogastric tube insertion may be needed to decompress the stomach, so frequent suctioning of the tube and tube care provided. IV fluids may require for the prevention of hydroelectrolyte imbalance. Parents are explained about the disorder, treatment procedure, and all the questions are answered to alleviate their anxiety. Minimum movement of the baby is ensured. After surgery, proper observation of and vital sign monitoring is done. Watch out for abdominal distension. Any bleeding should be reported immediately. IV fluids should be maintained as per doctor's order. Surgical sites should be prevented from infection and injury. Parents are explained about follow-up and care after discharge, especially in case of staged repair, because they need to come for follow-up regularly till complete steps of operations are done. Other nursing interventions include all nursing care of a hospitalized child that we have discussed in previous lecture under heading Nursing Care of Hospitalized Child in the lecture Child Health Nursing. For that lecture you can click on I button or you can visit my channel so that you can get access to those lectures. Dear students, you can also visit my blog, that is mynursingsstudentsblogspot.com, Twitter @student_support. Thank you.